Good morning, good afternoon, and good evening, and welcome to the Healthline Live Town Hall, COVID-19 one-year retrospective. We're broadcasting live from Healthline's offices in San Francisco. I'm Steve Swasey, Vice President of Communications for Healthline. 1 year ago today, March 11th, the World Health Organization declared the coronavirus outbreak a pandemic. Our lives have not been the same since. In the US, more than 29 million people have contracted COVID-19, with the loss of life numbering more than 526,000 people. Whether from the virus itself or its related ramifications, we've all been touched by the severity of this virus. And yet, through it all, we've seen some of the best that society has to offer. Whether it's the healthcare heroes, grocery and food service workers, or people in public service, communities have come together to support one another. We have proved to be a resilient people. Hope has been steadfast. In the Healthline Live Town Hall today, we'll discuss the many aspects of COVID-19, with particular focus on what's to come. We have an impressive lineup of panelists whom we'll introduce shortly, but first, a quick introduction to Healthline. Healthline.com is the world's #1 digital health information brand as part of Healthline Media, which itself is a division of Red Ventures. Healthline's mission is to build a stronger and healthier world. With our sister brands, Medical News Today, Greatest, and Psych Central, Healthline publishes more than 1,000 articles and videos every month. Our content covers the entire spectrum of medical conditions. It's evidence-based, medically approved, and empathetically presented. We work tirelessly to be your trusted ally in providing comfort, connection, and confidence in your health journey. Today's Healthline Live Town Hall will be co-moderated by Healthline Editor-in-Chief Aaron Peterson and Healthline Medical Chief Officer Dr. Elaine Han Lee. She goes by Han. Aaron and Han, terrific to see you.
Thanks so much, Steve, and welcome everyone.
Hello, everyone. Just so you know, Aaron, Steve, our crew, and I are practicing physical distancing here in the office. We're wearing our masks when we're around each other, and in fact, we're double masking because the new COVID-19 variants have been found to be more infectious than the original strains, and we recommend that everyone do the same to help prevent the transmission of COVID-19.
That's exactly right, Han. And even though it's exciting that people are lining up to get their first and second shots, and we're starting to see those first cracks of light at the end of this tunnel, we're not there yet. We are still very much in a pandemic, and so it's important to stay vigilant, to keep following those safety precautions, and when it's available and we're eligible to also get vaccinated.
Over the next 50 minutes or so, we'll talk with people who have had the virus or have reported about the virus, or both. First, Aaron will talk live with acclaimed broadcast journalist Leslie Stahl of CBS 60 Minutes. We'll hear from Tony Award-winning actor Brian Stokes Mitchell, followed by a live conversation between Aaron and comedian and commentator D.L. Hughley. Then Han will have a live discussion with two people who are very special to our hearts. The members of the Paula Green Smith and her husband, Philip Hamilton. She is with the Women's Black Health Imperative, and they both represent the Urban Health Resource. And we'll hear from actress and activist Alyssa Milano. This will be a discussion about COVID-19 and the merry aspects of it. We've received many questions from the media and our viewers, and we'll get to as many as possible over the course of the program. You may also submit a question in real time on Healthline's Facebook channel. As we're broadcasting live, we'll jump in if there is any breaking news. So let's go. Aaron, over to you to welcome Leslie Stahl.
Thanks so much, Steve. Few broadcast journalists have reached as many people for as many years and had as much of an impact as our first guest, Leslie Stahl. Ms. Stahl joined CBS News in 1972 when she covered the Watergate scandal and was the CBS White House correspondent during the Carter, Reagan, and most of the George H.W. Bush years. She joined 60 Minutes in 1991. She is an 8-time Emmy Award winner and the author of 2 books, Reporting Live and Becoming Grandma. Leslie contracted COVID-19 in spring last year. Leslie Stahl, welcome to Healthline. It's so great to have you here today.
Thank you. It's a pleasure to be here. Lovely.
Great. So I want to talk a little bit about your experience with COVID. You contracted it very early in the pandemic, and initially it said that you didn't want to insert yourself into the story. What changed your mind?
Well, I waited until I was completely, totally recovered, 100%. And then I wanted very much to thank the people who had taken care of me in the hospital, and to thank all the people who were caring for patients, either in hospitals or at home. I just wanted to do that little tribute. So I went public with it. I really wasn't trying to keep it secret. I wasn't working at that, but it kind of was secret. I'm not sure why, but I'm awfully glad that 60 Minutes let me make the personal thank you.
That makes a lot of sense, and we're glad to see you fully recuperated and here today.
Thank you.
And so throughout your career, you have covered many major stories, but what have you learned in the last year of covering COVID-19?
Well, I've learned that our system in the country that we all think is so sort of high level to produce and distribute is kind of woeful. And we kind of have to up our game moving forward, because as you just said, we're still in the middle of the pandemic. This is personal, but I also learned a lot about my daughter, who took care of me and my husband, who has Parkinson's disease and got COVID. She took care of us from Los Angeles. And I mean, took care of us. She got all our health needs taken care of. She ordered food for us. And she got me to the hospital when I needed to go. Although I didn't want to go, I'll tell you the truth. My doctor, who, by the way, had COVID as well at the same time, was yelling at me to go to the hospital. And I just adamantly refused because I didn't want to leave my husband. And finally, my daughter just screamed at me and said, "You're going, and I'm sending an ambulance." And she did. I'm not going to say she saved my life, because I never felt that my life was really threatened. Maybe it was, but I didn't feel it. And so I learned that. And I also learned one other little thing. I learned to say no. I changed a little when I was in the hospital. And I've come out and I've kind of reduced the things that I'm doing outside of my family and my job. I'm doing this, of course, which is outside, but this.
Well, and we're glad that you're doing it. But I think that makes a lot of sense because, throughout this last year, I think a lot of different priorities have come into much starker focus for many people. And so thinking also too, just about the role of the media in covering the pandemic. Obviously, as we've navigated different phases of this last year, there's been conflicting information or confusion just as we learn more about the virus itself, but there's also been a proliferation of disinformation. And what are your thoughts on the role of the media in combating that disinformation, but also building trust with the public at the same time?
Well, I'm going to be really honest with you. Mainstream media, obviously I'm part of it, has seen faith in us, trust in us, going on a downward slide. Obviously, the President Trump saying we're the enemy of the people didn't help. But I think that sort of fading faith was sliding even before he went into office. We can do our stories, and we have done our stories, and we've done public information campaigns. I don't think that's going to persuade people, I'm sad to say. I think it has to be someone local in people's lives that they trust. Preachers, ministers, priests, people who see and interact with people who are skeptical on a daily basis. I'm not sure any nationwide campaign is going to do it on television or even, on Twitter or wherever people are going for their information. Because, you're only going now today online to read about and hear about things you already agree with. So if you're worried about the vaccine, for instance, if you're not wearing your mask, it's going to be difficult to turn you around, even though you need to be turned around.
Yeah, and we see that a lot at Healthline too with our readers, where while they definitely go to their doctors and they do their own research, it often, comes back to that community and the people that they trust, that they go to for that advice.
Absolutely.
Um,
But
so I wanted to also,
they're tuning into Healthline, by definition, it means they trust you. If
that's what we hope.
well, people are not going where they don't agree. So if they're tuning into you, you have an obligation, and I think you have the wherewithal to reach people.
Definitely, and we take it very seriously at Healthline. But I wanted to talk to you also a little bit about mental health, because this has been a huge part of the national conversation throughout the last year as well. And I think in a lot of ways, the pandemic has sort of helped to normalize it. It's helped to kind of destigmatize it because it's touching so many people. And we saw this just recently in Meghan Markle's interview on CBS just this past Sunday, where she opened up very candidly about her own struggles, albeit in a very different context than the pandemic. And what are your thoughts on the role of media as keeping mental health in that conversation, both during the pandemic and when we're far beyond it?
Yeah, I think we have a huge obligation, especially if we can get to young people. Unfortunately, for the kind of widespread audience that I have at 60 Minutes, it's very difficult. You have to go where young people are tuning in, signing on, linking, because the suicides among young people, or the attempted suicides, or the threatening of suicide, is really increasing dramatically, painfully with young people. And they will turn to their sites that they usually go to for help. And again, it comes down to who do they trust? Who can they turn to? There are so many communities now online that young people go to, listen to, are influenced by. And that's where the interventions have to start. It's really difficult, because if you're in a position of medical knowledge, you may not be on those sites. You may not know about those sites. So it's incumbent upon all of us to figure out how to get messages through those channels. It's very, you're asking about how to influence. It's very, very difficult today. And each
Right,
site,
we have to meet people where they are.
you have to figure out where they are. Each site has a smaller audience than, say, broadcasters. We're into what they call narrowcasting, and it's a problem. And it's one reason probably that you are seeing this proliferation of mental health problems, where they don't even know where to turn. People in trouble don't know where to turn. I'll tell you, they're not going to turn to their parents. This is sad. And and if they're home isolated because of COVID, the places they can go shrink. So this is a real serious problem in our country. But you look forward to the day when this is over. Let's go back to school. You can perhaps begin to turn the corner.
Yeah, that's what we all hope. I wanted to talk to you also too. You mentioned your daughter earlier, and thinking about your family. In your book, Becoming Grandma, you wrote so lovingly about your connection with family and your two granddaughters. And how have you all stayed connected throughout this, during this time of isolation and physical distancing? And how do you talk to your granddaughters about what's going on in the world?
We stay connected through FaceTime. And I'm so struck by how the technology came around just in time for this crisis. If COVID had happened 2-3 years ago, we wouldn't have had Zoom. We wouldn't be able to do this, certainly. And I wouldn't be able to talk and see my grandchildren regularly the way I do. I've also seen them, to be honest with you. My husband and I both had COVID. We've both been vaccinated, and we've flown on an airplane, feeling very safe, by the way, and seen them in person, not often enough. So we do stay connected, but that's not what the vast majority of grandparents are experiencing. And all I can say to them is use FaceTime, because it does. You have this connection. I'm talking to you right now, and I feel that there's a connection between us, Erin. And I know that my grandchildren are staying involved with me and I with them because I can see them. Sometimes we just turn the FaceTime on and we don't even talk. We go about our business and we come back and
just hanging out.
Watch them color. I just sit here and watch them color, or play with each other, two little girls. So FaceTime is a godsend. That's all I can say.
Yeah, definitely. And just using whatever we have at our disposal to stay in touch. I love that. And Leslie, you mentioned being vaccinated, which is amazing, but what else is giving you hope right now? And what message do you have for all of our viewers who are tuning in about what to look forward to in the coming year?
Oh, I'm so looking forward to kids going back to school. I think that's number one. I've been worried about this. I don't know why we haven't vaccinated our teachers in that first wave. They did nursing homes in 1A. I don't know if you're all using those terms, but we do in New York. 1A, older people in nursing homes, and obviously nurses and so forth. But teachers should have been in that group. We're only getting to teachers now. It's kind of an outrage. So I'm awfully glad that we're moving across the country to get kids back in school. It's the highest priority. I can't think of anything more important nationwide right now. I have some optimism because in New York, first of all, it was so depressing to see all the restaurants, certainly in my neighborhood, close one by one, go out of business. Stores boarded up, and now already new restaurants are coming in. Stores are opening up, not a lot, but it's like the buds on trees. We're just getting into spring.
Signs of life.
And I know that we're going to come roaring back. I know it. There's no question. It'll take a little more time, but I am extremely positive about where we're heading after what we've been through. And we've all been through it. That's the other thing. The country, we have all been through it. I know we're polarized. We have our differences, but we've lived through this together. And I am even hopeful that will ease the tension. Oh my God, I'm too much. I'm a rosy person. This is silly.
Leslie, Steve Swasey here. Leslie, we love your optimism and your clarity, and thank you for that. As I'm listening to you talk lovingly about your daughter and your husband, you're also talking about resiliency, and that's a theme of today and the theme of our whole past year. And we're interested to know, you broadcast 60 Minutes. The venerable 60 Minutes has been on the air for a long time. You broadcast it from your living room. Tell us how you did that.
Oh, that's so true. Well, I just talked about how technology came around for us to stay in touch with our families. Look at this. Can you see that red thing behind me? I don't know which way to lean. Can you see it? Red thing over there?
Red thing.
Okay, so that is a recording studio, believe it or not, that I had to build myself. What it is towels and pillows in a box. And CBS sent me this very delicate, exquisite microphone. I record, where's my phone? I record on my iPhone. I record my tracks and what I want to say onto this. I record it, and then I email my recording to an editor, and he sews the piece together. Then he sends me a link of what he's done, and we edit back and forth on Zoom. So the miracle of technology has come around right now. We couldn't have done this 1 year ago, to allow us to keep going at 60 Minutes and have it look exactly the way it always looked, and sound. The sound that I recorded into my iPhone is broadcast qualities. So yeah, we've been able to keep going. Chug, chug, chug.
I love that. Leslie, thank you again so much for being here with Healthline today. We hope you stay safe and healthy, and it has been just such an honor chatting with you. Look forward to watching your reporting for years to come.
Thank you. Same to all of you. Thank you.
Thank you, Leslie. Well, Aaron, that was remarkable. Leslie Stahl, a venerable journalist who's speaking from the heart. What I took out of that is, not unlike the comment about politics, all learning is local. We've got to trust our friends, colleagues, and local authorities, perhaps maybe even more than the mainstream media. But I like what she said, that Healthline is trusted and we have the responsibility. You as editor-in-chief might want to comment on that.
Yeah, I definitely agree. And I think as health publishers, we have a massive responsibility to our audience to bring them the facts, but put them in context, but also to really just meet people where they are and speak to them in language that represents them and that they can understand. And so, I'm just so glad to hear that from her. And I really appreciate her optimism as well.
Well, it was terrific to have Leslie live from her living room this morning on March 11th. Thank you, Aaron. Our next guest is Tony Award-winning actor Brian Stokes Mitchell. The New York Times called him America's last leading man. Stokes, as he's called, contracted COVID-19 last year. After recuperating at the height of the pandemic early, in New York, he delighted his fans by singing a cappella The Impossible Dream from his apartment balcony every evening at 7 o'clock. That was when New Yorkers were banging their pots and pans in support of the healthcare workers and early responders. And he was out singing until the crowds grew too big and it became a spreader event. So he canceled his a cappella singing every evening. Stokes, as he's known, is filming a new TV show and couldn't be with us live. This is the nature of live broadcasting. He had to pull out literally at the last minute, but he did have time to send us this message.
Hey everyone, I can't join you live and in person as I had hoped. Well, live anyway, in person is still a challenge in this crazy time we are living through together. So my apologies for this pre-taped message, but such is the ever-changing production schedule for an actor during a pandemic. As you may know, I had a pretty bad case of COVID in March of last year. Thankfully, I live in a big city and have the means to get good care. But so many of our community members do not have this luxury. The virus is real, it's punishing, and it still is among us. So I encourage everyone to wear a face mask, stay 6 feet away from others, wash your hands frequently, you know the drill. And if you're ready, willing, and able, get the vaccine as soon as you can. Let's take care of each other, friends and strangers alike. That way, we can all get ahead of this virus and someday soon meet again in a theater, unafraid to share armrests and to laugh out loud together. I'd like to give a special shout out to my fellow artists who have helped us cope with our isolation during this pandemic. I think most of us have used the arts as an escape, whether we binge watch TV, films, escape through the music in our headphones, or even play video games. The coders are important, but it's the artists of those games that give a game its beauty and life. So thank you, actors, singers, musicians, orchestrators, producers, camera people, writers, directors, and designers for giving us all some beautiful oases to drink at during this most challenging and difficult time. And don't forget, this too shall pass. We're seeing that happen before our very eyes right now. So let's all stay well and love one another. Take care.
Appreciate that, Stokes. What a lovely message. 1 year after the lights went dark on Broadway, we're happy to see you working again, Brian Stokes Mitchell. Keep it up. From an investigative journalist to a Broadway singer and actor, and now a comedian with a message. Aaron, back to you for our next guest.
Comedian, author, and commentator D.L. Hughley has entertained audiences across multiple shows, including The D.L. Hughley Show and the Comedy Central special D.L. Hughley, The Endangered List, which was honored with a prestigious George Foster Peabody Award. He's also the author of multiple bestsellers, and his latest, Surrender White People, Our Unconditional Terms for Peace, came out last summer. Like many of our guests today, D.L. Hughley contracted COVID in 2020 as well. D.L. Hughley, welcome to Healthline.
Hey, now, good morning. How are you?
I'm doing great. It's so great to have you here.
Well, it's great
So
to be
I
here.
want I wanted to talk to you a little bit about your COVID experience because, like a lot of people, you were asymptomatic before
Right.
you actually tested positive for COVID, and you were tested because of this very frightening incident in which you collapsed on stage.
Well, I wasn't frightened. I
Talk
was unconscious. I wasn't scared. I was unconscious.
Yeah. Good clarification.
Everybody. Yeah. I was in Nashville. I was performing, and then I wake up in the hospital, and they ran all kind of tests, and one of the tests, of course, that they ran was the COVID test, and they found out I was positive, and which any virus, in conjunction with my schedule and not resting, and a whole series of events caused me to pass out, and otherwise I might not have known it. But I subsequently infected the entire office, that my radio show, my son included, and even the venue, the proprietor of the venue. So it was very it was turbulent, to say the least.
Yeah, I believe it. And what was the aftermath of that? Like, what was your recovery, and how are you feeling today?
Well, I feel a lot better. Well, I couldn't actually never get COVID in another city, and everybody knows you have it because you can't get on a plane, hotels try to kick me out. So I get home, and then because it was so public, when I'd gotten home to Los Angeles, I passed out again, and I had to go to the hospital. If it weren't for a lot of my Anthony Andersons and Cedric the Entertainer, George Lopez and Don Cheadle and Chris Spencer, we have this chat, and they were able to get me to UCLA. So, and to find out I was severely dehydrated, which a virus obviously tends to do. And I would say I started feeling better probably 2 months ago, where in terms of I would just be fatigued and dizzy, and then it would be my blood pressure would just drop all of a sudden. So it was I guess I would be what they would term a long hauler. So it's been an interesting journey.
Well, I'm glad that you started feeling better.
Me too.
And I know that on your radio show and on your various social media handles and in your comedy, you often, kind of talk about sort of hot topic issues of the day and create those discussions with your listeners or your followers. And obviously right now, vaccinations are a huge topic of conversation. And I'm curious about what has that been like on your platforms, and what are you hearing from your audiences, your followers on social, and what's the message that you're sharing with them?
Well, ultimately, there's a lot of mistrust, I think that this disease demonstrated all the things that they just exacerbated all the things that naturally exist, from healthcare, from the conditions of our medical treatments in our communities, from lack of resources, lack of caring, lack of empathy. It was a perfect storm, lack of information. So almost invariably anything that could go wrong did, and it just decimated our communities. And now it's just a lot of mistrust. I remember there is a place I grew up on 135th in Avalon. This clinic is on 42nd in Avalon. It's giving out vaccines. So we contribute to it and bring lunch and supplies and water and food. And so we go there, and it's right in the middle of the hood, and you couldn't get more Black and brown. And because there's obviously a need. Every person I saw online, out of the hundreds of people, were all young white people. And so even the resources that are available to us, we're not accessing. And I know I was speaking to someone from the city, and they were saying that only 3% of our population had been vaccinated, which is troublesome, because if a new variant hits, it's obviously going to can cycle out and start these same things over again. But I think that there's a tremendous amount of mistrust that have been born of all the things that have been kind of festering in this country for a long time. And it just hit at one time under the guise of this pandemic, which exposed just so many inequities in our system. And I'm mostly, obviously, I know what it's like to have COVID. I have taken the first vaccine. I made sure that I took my children and the people that worked around me to get it. We stood in line after a certain point. They have extras, and so you can stand in line and access that, and that's what we did. And I'm just gonna do what I've always done and try to live out loud and see as an example and show people what it is I believe and what it is I do, and if hopefully I can reach some people. But it is really a desperate situation because I see a lot of the people who are getting vaccinated and they're not us, and that is going to be problematic if we don't access this information. But how do you get people to trust a system that never has proven trustworthy?
Right, exactly. And similar to something we talked about earlier is that, it is, the onus is on those organizations, those institutions, those public health organizations to build that trust and to do the work, to walk the talk, really. And you mentioned something about sort of, your approach to this and living out loud. And I asked Leslie Stahl this a little bit earlier, but more in terms of the role of media and journalists. But what are your thoughts on the role of celebrities or other public figures like yourself?
Well, I think our role is to not be a spreader of misinformation. It's interesting because in our community, if you have all the credentials, if you're an infectious disease doctor, that doesn't resonate as much as if you wear a collar and speak on the internet. So we're suffering from as much misinformation. My cousin said, I heard this. So I've tried to be very deliberate in the things that I say, but ultimately it is this. I don't know very many people who have died as a result of taking the vaccine. I know scores of people who have died as a result of COVID. And so it's at a time when we need, and I think the media in that they have been complicit in that at a certain point, truth became expendable. We killed truth, and then we needed it at a time when we needed it wasn't available. We would, more people, you could get on the internet and spout truth, or you could get on a television and say these outrageous things. And then all of a sudden, when people get and to Leslie's point, people they only go to places that edify their perspective. I don't care if you're a vegetarian or you're a vegan or you're a meat eater, you're going to need other nutrients to kind of nourish and have a well-balanced approach. And I think you need that mentally too. I think we don't challenge ourselves. We don't, investigate other people's positions. And now we are in these echo chambers, and there is clearly a group of people who have a lack of trust for the medical, the medical arena in general, and the government, and all the systems that you kind of need to make this, to kind of have this cohesiveness we don't have. And it's all the things that have happened here coming on the roofs.
Yeah, definitely. And it's going to take a lot of work to rebuild that trust and get back to that place where facts do matter and where we can all agree upon the science, and we can all agree upon, what's right.
Right.
And
because science has been used, and I don't want to, science has been used to do any number of things. Like there's a man who has a statue in the middle of New York who performed gynecological surgeries on enslaved women, and he is the father of modern gynecology. So I think science has been used to do the Tuskegee span, any number of things. So really, at a time when you need science, when now you're supposed to be able to lean on science, that relationship is fraught, and it's just. For me, it is. I understand, and I try to educate myself to the extent that I can. But I know how important it is for my people and people who come from my communities. I know how desperate it is, and I know how urgent it is, because if any one of these new variants it becomes resistant to the current vaccines, then we start. Something was very interesting. The American life expectancy dropped a year in 6 months. Yeah. 1 year. Black people's life expectancy dropped 3 years. 3. So if this happens again, we don't have lives and years like that to waste. We already live longer, less time than anybody else. But this thing is literally taking years off our lives collectively. And I just, it's hard to say that in a joke or a book that people get, but it's just that desperate to me.
Yeah, it is a desperate situation. And I think you bring up a really good point that is a great reminder, both for, health organizations and Healthline as a health publisher, that we do need to call out those parts of our history and our present that are wrong, and that are those objective measures that are built on falsehoods and that disproportionately impact negatively Black and brown people, for sure.
Right.
And so, thinking on, the months that have passed since your infection, are there any kind of lingering lessons that really stand out for you that you would like to share with our audience today?
I thought, I'm a pretty healthy dude. I work out, I drink a lot of water, I exercise, I try to eat pretty good, and I was pretty certain that it wouldn't happen to me, and it did. And when it did, virtually, I didn't have the debilitating effects that some people did, but I had the long haul effects, the fog, brain fog, the fatigue, the dizziness, I felt outside of myself for so long. I wonder if I would ever get to see me again. And so even the mental, the thing that you need it's difficult, because the things that I would always have as a level of catharsis is being on stage and being around people and performing. That's taken away. Other people, it might be a church, and that's taken away from me. Other people's a school. So, and I think one of the things that in our community is really important is physical touch. Well, you're denied that too. I mean, the first time my father-in-law, who's very close to my children, got to hug his granddaughter was a week ago, and they hadn't hugged in a year. And it was very touching to watch that happen. So we're almost disconnected from everything. And I think one of the lingering effects of that is a sense of loss, and not just of lives, but out of connection to a community, a connection even to yourself. So it's going to be sorting through and kind of getting started again is almost as fraught with kind of trepidation as the situation is right now, because it's at least this. I mean, it's like wearing tight shoes, so you feel good when you take them off. So.
Well, and now we're coming up on we're on the 1-year anniversary of the pandemic, and a lot of people have been sharing across social sort of their last normal thing, the last normal thing that happened before this, everything kind of went sideways. What was your last normal thing, and what are you most looking forward to once we do get to the other side of this?
The last gig I had was in San Antonio, Texas. And I remember my agent calling and saying they might have to reduce the capacity of the room. And I was like, what? And he said, oh, yeah, but I think, and they were talking about, they were going to it's a week or two, you might lose some gigs or whatever. And then I got home and, I would see it on the news. I get a call from a friend of mine, and I'm at the golf course, and he goes, you got to be home by 5 o'clock because Gavin Newsom shut down the state of California. I'm like, what the hell are you talking about? You can't shut down California. We're the fifth largest. And you better believe we're supposed to have our ass home. I could not fathom that was possible. Like, I couldn't believe it. Like my wife, of course, she was, I read about this and I heard about it and I'm getting alerts. I'm like, whatever. It actually happened. And it was like, you couldn't, like, for a while here, they closed the beaches, they closed the running trails, they closed the golf course, everything. So you just had to be home. And it was, I've always been very cynical, but I just never, that scope of reaction never entered my mind. And it was crazy. It was crazy. The one good thing about you get weed delivered, that was great. I think that's
fun fact, that happened on my birthday last year, and
was your birthday?
As a result, no one wished me a happy birthday.
When was your birthday?
On the 16th. That was when we got the note from Newsom.
My birthday's March 6th. Happy birthday coming up.
Oh, so, hey, Pisces.
There you go.
Now I'm watching two friends here talk about their birthdays. Deal. Thank you for joining us. It's
very much
here. As you were talking about the last gig in San Antonio, when are we going to see you live again?
Well, I'm gigging now because unfortunately, when it's calf capacity, I say if you want to work, you got to go to a state where the governor doesn't give a damn about his people. If you want to work, there are a few places you can work. But I'm looking forward to being able to work in front of full crowds, because even when you work, there's a disconnection. Like, there's glass everywhere. Literally, it's so much plexiglass. I don't know whether to order a tank of gas or tell a joke, but I miss the connection of, and even when they are there, there's such fear. They're aware of what's going on because it's disinfected. I'm just looking forward to people laughing out loud without wondering if the person that's next to them is in danger in their life.
Before you go, DL, just want to invite you to stay on the broadcast here if you have time, because I know you're going to enjoy the conversation that we'll have upcoming with Han Lee, our Chief Medical Officer.
I got to get high. I can't stay here. I have to get high and get ready for my show. I'm sorry.
You'll get high watching Paula with Philip Hamilton.
Enough of you doctors. I need Dr. Green. That's where I'm going.
Well, DL Hughley, thank you again so much for being here today and sharing your insights and your thoughts. And stay healthy, and we look forward to sharing more laughs with you in 2021.
Likewise, and happy upcoming birthday.
Thank you.
There's genuine authenticity. Love that interview, Erin. Thank you. Calling out yet again the local trusted allies. Couldn't be much more of a stronger message.
Yeah, I totally agree. And I really appreciate him driving home the point that when we talk about that sense of mistrust, especially in the Black and Brown community, that it's important that we reflect that back on the organizations and the institutions in power that have the resources to change that.
Well, thanks, Erin. Our next guest is an actor, a producer, a host, an activist, an entrepreneur, a humanitarian, and a New York Times bestselling author. She does it all. Alyssa Milano is known as much for her advancement of the Me Too movement as her on-screen roles. She contracted COVID-19 last year, and since then she's been at the forefront of informing and educating people about the virus. Alyssa could not be with us live today, but Erin Peterson caught up with her earlier in this recorded interview.
Alyssa Milano, thank you so much for being with Healthline today.
Oh, it's my pleasure. Thank you for having me.
Great. So I wanted to get started by just asking you a little bit about your personal experience with COVID-19. You had gotten sick very early on in the pandemic when there was still a lot that we just didn't know. And so what was that like for you?
Sure. So my first symptoms weren't actually respiratory at all. They were stomach symptoms. And then I laid down for a nap and I woke up in full body pain. My chest started to feel like heavy, like there was an elephant that was sitting on my chest. I had a low grade temperature. Again, another reason why we were like, probably not COVID, because people with COVID have high fevers, because that's what we heard.
Mm-hmm. And you had shared that you were tested, I think 2 or 3 separate times and got false negatives each time.
Yeah, my test shockingly came back negative. And then, the next day I felt worse. And then the day after that, I was like, I can't breathe.
Wow.
And I called the doctor who was overseeing my care at the time, who happened to be a pulmonologist. He was a concierge doctor, and he was like, look, this is pneumonia. We're treating you for pneumonia. I was on an antibiotic at the time. Your test was negative. But he said, I don't want you to go to the hospital. Try not to go to the hospital. They're putting people on respirators. I'm a pulmonologist. I know that is bad news. Do not go to the hospital.
Wow, it is hard to imagine a scenario like that happening today.
Yeah, I mean, I finally felt well enough to say to him, you know what? I feel like I need to get tested again. Mm-hmm. And he's like, okay, but I'm telling you, the test was negative. I said, I know, but there's a lot of news right now that the tests weren't complete when they were sent out. And, maybe it was a false negative. Maybe at this point they've gotten better at it. So I go again, negative.
Wow, that is hard to believe.
So then my best friend Allah, he said, I guarantee you, if you go get an antibody test, I bet you have the antibodies. Mm-hmm. And sure enough, I went and I got the blood draw, not the finger prick when they first started, but I got the blood draw out of my arm and I had the antibodies. And that was about 4 months after I was sick.
So quite a journey in those 4 months.
It was a lot. And I got to tell you, Erin, the whole time I was dealing with it, I kept thinking, because the activist in me, I was like, how are people doing this that don't have access to a concierge doctor or, you know, or a nebulizer in the house, or, you know, any of the luxuries and the privileges that I had to overcome it at home. And so, yeah, I mean, part of me felt blessed, but it was very difficult.
You mentioned your activist work earlier, and I think that you're someone that people see as being unafraid to speak up and speak out about important topics. And in sharing your COVID experience, is that something that came instinctually to you, or did you have to kind of think about whether or not you were ready to be that vulnerable with so many people?
You know, I felt like my contribution to this, and what gave my sickness purpose, would be to use my experience to really educate and empower people on that this is not a hoax, that this was not something that felt like the flu or the cold, and that this was, you know, something that attacked every part of my body, and I wanted people to know that.
So I wanted to shift gears for a minute and look a little future forward, because right now the vaccine rollout is creating a lot of hope for people that we'll be able to get this pandemic under control. And I'm curious for you, are you still planning to get a COVID vaccine when you're eligible? And what has that conversation been like with your family, your friends, or even your followers on social?
I mean, I think people want to get the vaccine. I think people are ready. I think there is obviously a small group of anti-vaxxers that are suspicious. But the majority of people in my life that I have spoken to, that I have read from on social media, are very much looking forward to getting the vaccination.
So before we wrap up, I wanted to ask one more question, because you've talked a lot about how this year has given you the ability to slow down a lot more and spend more time with your family. And I'm just curious if there's any other unique or surprising positives that have come out of this year for you.
Once I started to feel better from COVID, I started to teach myself how to watercolor paint.
Amazing.
And it's been so special to just be able, first of all, to be really bad at something at this age is very interesting. But also to like work at it and practice at it and get better and better, and to use it as one of my tools, you know, for my mental health and well-being, has been really lovely, and something that I'm really grateful that I've had.
Alyssa Milano, thank you again so much for chatting with Healthline today.
Oh, it's an honor. Thank you so much. Thank you for having me, and thank you for all the wonderful work that Healthline does in getting information out and taking care of people. I really appreciate it.
Thank you again. Take care.
Thank you.
Lovely interview, Erin, with Alyssa Milano. So good to see her fully recuperated. And I really like what she said. People want to get vaccinated. You heard D.L. Hewley say, people are getting vaccinated. We want people to look at that positively based on science and evidence. And it is something that's only going to get us to the herd immunity that we need. Our next guests also contracted the virus, and they've been advocates for COVID-19 awareness and education in their communities. I'm very pleased to bring in Dr. Han Lee, Chief Medical Officer of Healthline Media, to introduce our next guests.
Thanks, Steve. Paula Greensmith is Chief Training Officer of the Black Women's Health Imperative, which bases its work on the fundamental question, what if all Black women and girls enjoyed optimal health and well-being in a socially just society? Paula and her husband, Philip Hamilton, are executives at the Urban Health Resource in Detroit, which promotes and provides community education, outreach, and affordable health care for uninsured and underinsured citizens. Paula and Philip contracted the virus, as you mentioned, about a year ago. They're here today to discuss their personal experiences and the inequitable toll the virus has taken on the Black community. Paula and Philip, welcome to Healthline.
How you doing? Good. Thank you.
Thanks so much for joining us. So it's been several months since you contracted COVID. Are you still experiencing symptoms like what D.L. Hewley was just talking about earlier?
Actually, yes, but very mild now. The one that I feel the most is I have an arm pain that continues, and it's almost like every week I know that that's going to be here at some point. I went through the brain fog. I was so happy to hear others mention that because I was really nervous. You know, I have a mother that had dementia before she passed last year. And so I started thinking, okay, gosh, is it dementia now? What else? You know, so it was really good to hear the symptoms that others had, just to kind of make us understand that it wasn't just us, and it just kind of put things in perspective for us. But yeah, we're great. And it was such an ordeal to go through that we feel great. And what we're feeling now is minuscule.
Well, I'm so glad to hear that you're feeling much better. We've also talked about, and we've heard that the COVID-19 pandemic has disproportionately impacted the Black community. DL mentioned that himself, and also mentioned the mistrust in the Black community too. Can you help us understand what that looks like in real life?
Well, you know, as DL mentioned, there are so many people that remember the Tuskegee experiment or have heard about it. And, you know, just the information, the changing information, when we first contracted COVID and when it first hit our community, there was so much misinformation out there. I remember when we first, we had been traveling and we got back and found out that, you know, what was going on with it. And we usually go and hang at this little jazz club every Friday night. And we got a call on a Friday night saying, hey, are you going to meet us up there at Baker's? And we said, you know, no, we're laying low because of the virus. And we had people to say, well, you know, Black people aren't getting that. So it's so much misinformation out there, and that compounded with the stuff that we know is real, the Tuskegee experiment, the Henrietta Lacks story. A lot of people mistrust, and this whole COVID situation being so new and so different really compounded that mistrust in our community. So we were hearing that from a lot of people, that first of all, Black people don't get this. And then when they realized, yes, Black people do get this, then it was, you know, I don't trust the doctors. And, you know, a lot of us have doctors that are new in our communities and don't look like us, and people don't trust the people that don't look like them. And so we saw a lot of it. We still hear some of it, and it's real.
Right. I think last year we were traveling, so when it was occurring here, we didn't get to see the full effects till we got back, because we had some prominent people here that got sick and died. We were traveling, so we got back about the 13th. And it was a Friday, as Paula said, and we didn't see that until that next week when we got sick. Yeah,
right. And I think a lot of people were saying that they didn't recognize it or acknowledge it until it impacted them. And I think you had mentioned before that there wasn't a week that went by that you didn't hear of someone that you knew who either got it or died from COVID-19.
Yeah, our community was hit so hard. Early in, was it March? It was, there were like 3 big events in March, early March, where like major, you know, players in our community, leaders, community personalities. There was a ballroom dance. You know, Detroit is a big ballroom dance community. And there was a big ballroom dance program where a lot of people were infected. Then there was a police and pancakes prayer breakfast where a lot of people were affected. So we had our police, we had at one point there was like over 450 police officers in quarantine because there was a pancakes and police breakfast. So we saw not just our community members, our neighbors, our families, but we saw some of the most highest profile people in our community being affected by this. And we've had many people to die. I mean, some of our most popular DJs, our Wayne County Sheriff was a very, very popular politician here. It's just been, our community was ravaged by it. And it was really difficult. We had, like I said to you before, we didn't have a week until probably maybe August where we didn't hear of someone, whether it was a relative of someone or someone we knew personally, to pass.
And I think you just touched on a very important point, and Leslie Stahl mentioned it earlier, that we hear information, but really the most impactful information comes from the local community leaders. Mm-hmm. I think, the Black women's health imperative is really pivotal in that. Your roles as community leaders is pivotal in that. Could you help us understand what all that entails?
Well, for one, our programs, our signature programs, all of our programs and our initiatives are around improving, advancing the health of Black women and girls throughout this nation. And you cannot improve the health of Black women and girls without touching Black men, Black boys, our entire Black community. And so we actually, one of our other programs we run for the Black Women's Health Imperative through Urban Health Resource here is our diabetes prevention program, Change Your Lifestyle, Change Your Life. And what's really great about that is because we're typically very healthy people anyway, but because we run that program, we model what we preach in our program, what we promote in that program. And that program helps individuals to prevent diabetes and other chronic diseases by making lifestyle changes. And so basically we help people to eat healthier. We help them to move more. We promote that through showing, giving them full access to healthy ways of eating, healthy ways of moving, practical ways of eating and moving. And so because we're out in the community doing that already, and we have groups throughout the community, that's something we do. That's something people that know us know we're going to always talk about. And so that helps us to get the word out and do what we're doing for Black Women's Health Imperative, as well as Urban Health Resource here in Detroit.
And has the Black Women's Health Imperative worked on COVID, and how has that conversation with your community changed in the last several months?
Well, the Black Women's Health Imperative has given us every opportunity. We have opportunities here in Detroit to talk about it and to share our story and to talk to as many people as we can about why we think we were able to pull through it. And we know that's our healthy lifestyle. Our program is an evidence-based CDC-led program. So we are always able to talk about that with individuals. And so the Black Women's Health Imperative enables us to do that through Urban Health Resource. And then because of my role with them as well, they have allowed me to be on platforms such as this, and anything that comes up, we're able to talk about it and share our stories. And, because Black Women's Health Imperative is really by us and for us, we know our communities. We know how to talk to our people and to relate to our people, and our people listen to us. We are trusted messengers, and we know how to work with other trusted messengers to get the word out. And that's what it takes. I think everyone that's talked about this today has talked about the fact that you got to have trusted messengers, people that other people will listen to. And that's what's happening. And so we just appreciate that opportunity, because there's so much we have learned, even being healthy people. There's so much we've learned from this experience, and just being able to have the platform and be a part of other platforms, as the Black Women's Health Imperative has allowed us to do, has just been invaluable.
It sounds like you've had great success. What are your key learnings that you feel has helped you really build that trust and really get people engaged in this conversation?
I think being real people, doing real things. I mean, it's one thing to have the experts come and talk, but real people listening to each other. We're very social. Normally, before COVID, there's not a week that we don't go out and socialize with others. And so being able to bring the message to people in a social environment, but in a layperson's way, to just say, look, this stuff is real. You got to listen. This is evidence-based. Listen to the science, and helping people to understand the science. Don't you think being able to just be able to make it relatable, and always be willing to share that information, share our experiences, and share with others what we have learned from our own personal experiences, and try to help others with it.
I like to say get healthy. That's one of the main things we work on in our pre-diabetic prevention, but we need to get people healthy. Yeah. And that's one of our mission after we recovered from that.
Yeah.
I love that.
That's practical ways to get healthy. If you tell people you got to get healthy, you got to go lose all this weight. Yeah, we want you to lose 5 to 7% of your body weight to start preventing diabetes and start working up. But do those baby steps. There are so many little things you can do. And that's, what we've been able to do and to talk to others about. And that's one of the benefits of this pandemic. I think a lot more people are getting healthier.
I love
Paula,
that. That's exactly what we do at Healthline too, is talk about the evidence, but also make it very relatable and actionable for the individual so that they can know how to make the best decisions for themselves.
Yeah.
Paula and Philip, Steve Swasey here. I've enjoyed hearing your comments clearly about the need for localized trust. When we spoke a couple of weeks ago, you had mentioned to me that right after the baseball great Hank Aaron passed away, the Black community spread information that it was because he took the vaccine. Has that rumor squashed, and is it still prevalent?
I think it was short-lived, because at that point the vaccines were new, were newer, and when people don't have full information, they'll create information. And then there was a lot of misinformation out there on the internet, on Facebook and so forth. But I think that, again, hearing from ministers, hearing from, prominent doctors, prominent celebrities, just hearing from so many others has really helped with that. So I think that was a big roar at first, but I was surprised at how quickly that dissipated.
And I think people want to help. I think the vaccine and hope, and I think that presented an opportunity for them to get that. And so most of our people that we're in surrounding with is getting it, trying to get it, or have taken it. And that's one reason.
It's interesting. I think I told you we were at opposite ends of the spectrum. Philip was gung-ho right away, gonna get it, ready to go. And I was, we're gonna wait. I'm gonna wait it out and see. But I don't try new beverages first. I'm gonna wait. I'm gonna be the last one to try everything. But I am surprised at how many people are on board with it and are encouraging others, even friends that I'm usually saying, we got to be healthy. We got to do this. We got to do everything to stay healthy. I have friends calling me up saying, have you decided? Let me tell you why you need to decide to do it. So it's coming around. It's coming around. And I think there are more people that want it and are waiting to get it than I hear of that don't want to do it now.
One of the reasons I wanted to get it, besides for myself, is to convince her to get it, my wife, to get it, because I know what kind of resistance, because we talked about it, and I know she's not up for trying new medicine, or she hates any type of medicine. So I knew that, and I wanted to prove to her and to others to get it. Yeah.
I'm pleased you're speaking with yourselves. Philip and Paula, thank you for joining us today. Han, any last thoughts for Philip and Paula?
Well, I think you perfectly encapsulated it. It's that constant question of what is the evidence, what's the science, and if we start to see the positive signs, then why don't we do it for ourselves, but then for others in our community to protect each other? Yeah. Philip and Paula, it's been such a pleasure and an honor to speak with you.
Thank you.
Thank you.
Right. We appreciate the opportunity. If we can help, we're going to do it. Thank you.
Keep up the good work. Well, that was a powerful discussion, Han. Let's invite Aaron Peterson back in to wrap up. You both interviewed some pretty remarkable people today, and we had some good recordings. We did have one guest who, because we're live and she's in the media, was unable to join us. Dr. Jennifer Ashton, who's the chief medical correspondent of ABC News, had committed and was eager to join us, and literally had to go out on assignment 15 minutes before we went live. So we just heard from her right before the broadcast. She couldn't do it because of breaking news. We've been watching to determine what that breaking news is and don't know, so we don't want to speculate.
Well, that's unfortunately the nature of COVID-19, right? News and scientific developments are happening at lightning speed, at an unprecedented velocity. At Healthline Media, we're actually really used to that. That's exactly what we live with as well. But we maintain the highest medical integrity and rigor. So we're always trying to stay ahead of it ourselves so that we can provide our audience with the most medically accurate information so that they never feel like they're experiencing medical information whiplash. It's our mission. We work hard to keep it up.
Right. And as I watched all of our panelists, I heard repeatedly localized information from people you trust and empathy. I think, Aaron Peterson, that pretty well summarizes what we're offering at Healthline Media.
Yeah, Steve, I totally agree. And it has just been so great to have this opportunity to hear from all of our guests today about how they're using their platforms or resources or privileges to have these important conversations. And I just have to say that I am so grateful to folks like Paula Greensmith and Philip Hamilton, organizations like the Black Women's Health Imperative and Urban Health Resource, who are on the ground in the community, have been there before the pandemic, will be there long after, really doing the work to make sure that people have access to the care that they need to live stronger and healthier lives. And it's really inspiring.
Truly, what a privilege to speak with so many wonderful panelists today and to hear so many strong, powerful, firsthand accounts. What I was struck by is how the participants really encapsulate the best silver linings of this pandemic. It's been a terrible time for everyone, but there are some great, silver linings in that we have people who are ardent supporters of science and evidence. As a clinician, I love that. But we also had artists and community leaders who really represent the humanity of who we are. And it's that marriage of facts, science, evidence, and spirit that really provides me with hope for the future.
Well, if you'd like more information from our meetings today, please log on to Healthline, which is www.healthline.com, or follow any of our social media pages. We'd like to thank our guests, Leslie Stahl, Brian Stokes-Mitchell, D.L. Hewley, Dr. Jennifer Ashton, who was not able to join, Alyssa Milano, and Paula Greensmith and Philip Hamilton. We ask them to continue to do their good work of informing us, entertaining us, and educating us. We'd like to thank you, our audience, for joining us. We ask you to stay strong and healthy. Keep wearing your masks or two, and get vaccinated when you can. With Healthline Editor-in-Chief Aaron Peterson and Chief Medical Officer Dr. Elaine Han Lee, I'm Steve Swasey from Healthline. Good morning, good afternoon, and good evening.